am going to give the mic to Jacqui Stewart. As I said earlier on, Jacqui is the Chief Executive Officer of the Council of Health Services Accreditation of Southern Africa. So Jacqui, over to you.
Thank you, Sunny, and good evening to everybody. Good afternoon, good evening. It's been an absolute pleasure just listening. I get such a warm feeling when I listen to colleagues who are talking about safety and quality, and the passion that comes through from all of you is just wonderful. And I think the challenge that we all have is, how do we make that passion a reality at the bedside and in the clinic? Because we've really got to make sure that what is in the strategy, what is in the document, what the WHO is putting out, what countries are putting out, actually becomes a reality for our patients. And I think that is our biggest challenge. The Council for Health Service Accreditation of Southern Africa, COSASA, is a quality improvement and accreditation body. And I firmly believe that accreditation can drive patient safety because it puts in place systems and processes to ensure that things work, that people understand what they're meant to do, when they're meant to do it, and how they're meant to do it. And with the beauty, I think, of accreditation is that it embeds the whole culture of continuous improvement into the institution, from the security guard at the gate, from the person who picks up the rubbish, to the most senior consultant. Through everybody is involved. And I think that's what we've got to make sure when we think about patient safety. We have to make sure that we talk about the whole institution. It's not the domain, and one of the previous speakers said this, it's not the domain of doctors, it's not the domain of nurses, it's not the domain of any particular professional group, it's the domain of everybody who works in a healthcare facility. And we mustn't limit it to just the clinical staff. We must ensure that it goes to everybody, the people who handle food, the people who handle the housekeeping, the people who do the maintenance of technology. Everybody needs to be involved in patient safety. And the question I always ask when I go and do training, I don't do it very much anymore, but when I would do training in facilities, I would say to the team, how many of you would let you or your family be treated in the hospital in which you work? And sadly, the response used to be like 10%. And that is shocking, because we should be able to say, if I'm working in a hospital or a clinic or wherever I'm working, I'm happy for my family to be treated in that facility because I know the care is good. And I've loved what I've been hearing from the previous speakers, from Steve and Paul and Loretto. We have got such a lot of talent in this continent. Can we now start to use the talent in the continent to improve the safety of patients across Africa? We talk about silos, and there are issues with silos with donor funding. There's a lot of issues with silos, but we're one continent. We're 54 countries, but we're one continent, and we have so much talent. And we're beginning, Sunny has been a great leader in beginning to move this across. And we're talking about what can we do in the continent. We have to start sharing our experience and our learning and using that experience and then benchmarking with the UK, Australia, America, wherever. But we really have to benchmark in the continent. And my biggest plea is, I run an accreditation organization. We have internationally accredited standards. And the saddest thing that I hear is when people that our standards are too high for Africa. And I completely dispute that, because every African patient deserves as good a standard as any other patient anywhere else in the world. So I just put out the plea that there's some great work going on. We have some amazing talent. You just heard of the wonderful work that Lydia's doing in Kenya. We think we're doing some great work in different countries in the continent of raising the standards. So I put out two pleas. One is that we put patient safety and quality, which I think are actually the same thing, because you can't have a safe patient if you don't have quality care, and you can't have quality care if you don't have safe patients. And we put all of those into undergraduate and pre-registration training. They do not belong in postgrad. They belong in undergraduate care, that our students from day one understand that the highest quality care, whether it be washing your hands or whatever we're talking about, is essential. And the second thing is that as Africans, we collaborate and we share our knowledge across the continent. We have so much talent in this continent. We really have so much talent. Let's share it and let's use it. I've had personal experience in hospitals of having only been there for 2 days, but just bad experiences. And we talk about the strategy documents, but the strategy has to get to the ground level. We have to ensure that our workers, whether they be healthcare workers, whether they be nurses, doctors, physios, porters, whoever, understand the safety of patients is critical, because it's also about the safety of our healthcare workers. And if both of them are safe, the hospital, the clinic, whatever healthcare environment will be safe. So thank you. And I'm just so encouraged and enlightened by all of you. It's so lovely to be here with you. Thank you. Over to you, Sunny.